Now I will talk about the anatomy of the suprarenal gland or adrenal gland. Both terms are used, but I prefer suprarenal gland. As you mentioned, as you see here, the suprarenal gland is located above each kidney. Here is a dorsal view of the kidney, which shows up to both adrenal glands, and here also here. So here is the learning objectives. We should know the embryonic origin of the gland. We should know the morphology, relations, the blood supply and nerve supply. Also, we should know the surgical approach to the gland and histology. As you see here, here is the gland above the kidney. Here is the right adrenal gland, and here, when you cut it like by knife here, you found it's formed of two structures: cortex inside, cortex outside, and the medulla inside. Here is the suprarenal gland. As you see here is right one, and here's left one. It's located in the posterior abdominal wall, and here is the blood vessels. It's retroperitoneal organs, means it's behind the parietal peritoneum of posterior abdominal wall. Of course, here is the anterior abdominal wall, here is the posterior abdominal wall. We removed the anterior abdominal wall here, and intraperitoneal organs like stomach, like spleen, and also we removed the peritoneum to show this, to show the suprarenal glands. Here is a little busy. This slide contains many informations, but as you see here, this is relations of the gland. So here is the right gland. As you see here, the right suprarenal gland is located between the inferior vena cava anteriorly and the right crus of diaphragm posteriorly. Here is the left suprarenal gland. The left suprarenal gland is located behind the tail of pancreas, and also it's crossed anterior by spleen, and it forms part of the stomach bed. The right suprarenal gland is triangular in shape. Left one is similar, and it's about 5 grams. Here is cross section, which shows the relationship again of the gland. So here is the right suprarenal gland between inferior vena cava anteriorly and the right crus of diaphragm posterior. Here is the left gland, which is located between pancreas anteriorly and left crus of diaphragm posteriorly. And this is important to know because during surgical exposure of the gland, we have to avoid damage of the IV inferior vena cava during operation. Here is blood supply of the thyroid gland. Every gland has 3 arteries: superior suprarenal artery, middle suprarenal, and inferior suprarenal. Superior suprarenal arteries here, it comes from inferior phrenic artery, which branches from abdominal aorta. This artery, we call it middle suprarenal artery, directly from abdominal aorta here, and inferior suprarenal artery comes from the renal artery. Each gland has one vein only. The left suprarenal gland has left suprarenal vein, which drains into the left renal vein, but on the right side, the right suprarenal vein drains direct to the inferior vena cava. Here we show how to approach the left suprarenal gland through the transperitoneal approach for removal of adrenal gland tumors. So for this approach, we have to reflect the organs which are superficial to the gland, like spleen, like tail of pancreas, and of course stomach should be reflected. And note that should be reflected laterally. And then note that in this here is this left gland, not right. It's just a mistake of the text. That's all. So transperitoneal approach is used for access of the left suprarenal gland, or right for removal of adrenal tumors. Approach. Here is extraperitoneal approach to the suprarenal gland, but it's not common for. It's not common. We use mainly the transperitoneal approach, but this approach is used for exposure of the kidneys mainly from backside. Here is a plastic model which shows the location of the suprarenal glands on the posterior abdominal wall. Here is the right one. Here is the left one. You can see here is the inferior vena cava, here is abdominal aorta, and you can see some veins which
For example, this vein which drains the right gland, it is tributary of inferior vena cava, but in this model it is tributary of renal veins. That's wrong. Okay, it should be tributary of inferior vena cava. Here is the left side, left suprarenal gland, where you can see the left suprarenal vein which drain to the left renal vein. Here, this model shows some relationships. For the left gland, it's crossed anterior by pancreas and spleen, and here also the stomach. It is related posterior to the left class of diaphragm. In the right side, in the right gland, it's crossed and it's anterior. There is IVC or inferior vena cava anterior to it, and behind it there is right cross of diaphragm. And here is the learning sources for gross anatomy, gross anatomy, more clinical anatomy, and my paper, Eid Nabil. Here is the histology. I think it's enough. You can study by yourself. Thank you.